By final year. I'm not the doctor. I'll call the doctor for you. Outside. Crazy. Members can, relate. Because you don't know. Like today's admission day 16. Currently, there are no complaints. It's just like, I'm coughing. Hi.
Hello. So we are here again. So Dr. Ajwa Binyua Amwa.
And I'm Angela, Dr. Angela Slimana. And in today's video, we are just comparing medical school days with working as a doctor.
Yeah.
These two. Because we've been medical students for like 6 years.
6 years, exactly.
We finished last year around October.
Yeah, it was September.
August.
September. It was September.
And actually October. Yeah. Sorry. Working as doctors for 7 months now, or 8 months, I think. 8 months, because 8 months now. So I think it's enough time to do some comparison. 6 years and 8 months is cool, right?
Yeah. Yes.
Yeah. First of all, we like to compare like the stress you go through in medical school with the stress you go through in house job. Just so you can share experiences.
I know every medical student will say medical school is stressful, but please, have you met house job?
A whole level.
Okay, so fine. Medical school, you have assignments, you have group works, you have like some group studies, you have exams. Those of us who did the block system, we failed that kind of
every 4 weeks you have to write exams, so you have to keep up with learning and all that
thing, But when I started house job, that was when Okay, so house job has its own perks and all of that, but the stress is really
another level.
It's undeniable. It's undeniable because right now you are supposed to clock your patients, examine, and then give your stats.
Yeah.
At least you have to stabilize the patient before your boss comes in to give you your final treatment plan.
Yeah.
However, the long, working hours, some of our schedules, you can have like weekend duty throughout the entire weekend.
Right.
In the hospital. Some of the working hours.
You basically don't have a holiday. That's the whole thing.
And you
There's
go
no
to work
holiday.
every single day from Sunday to Sunday. You are at work. However, in medical school, Fridays you are happy because Saturday, Sunday, unless your team is on duty and you're supposed to come, you are free.
Exactly.
Do you understand? Yeah. So I don't know if you have anything to add.
Yes. So being a medical student is also like another level of stress, but like Ajwa rightly said, house job. You're sleeping and thinking if you kept the patient on some medication your boss said, or you have to wake up early and be at work, and then generally everyone is just complaining to you. You don't have enough time for yourself. Even when we were in medical school, we used to have hangouts.
Yeah,
we didn't have enough money, but we were chilling. Now we have like kind of basically little, but then we are not even getting the time. We're not getting the time to go anywhere.
Yeah.
And then it's a problem. There are some times where you just want to stay at home and you say, you have headache, you have this, you stay at home.
I'm not in the mood to step out. I want to be indoors. No, you can't
do that in a house job. You just can't do that.
Whether you're in the mood or not, you're going to work.
I'm going to work.
Then also the fact that when you are in medical school, you wouldn't have to talk to so many people, like as the patient's relatives. It's not your duty. Yeah, it's not on your head. But as a house officer, oh God, you will actually talk. You will talk, explain the patient's condition, explain blah blah blah, explain why you're giving this drug. Some of the relatives are pretty informed, like they are open-minded. They would ask you, Doc, so why are we getting this drug? Why are we getting this? So you need to know your subject matter. Yeah, because you will talk a lot. You will talk.
And then you have holidays, like we rightly said. If there's an important holiday, medical school, you would be happy. You be in your house.
No school.
My house job, you don't even know the day. You don't know today's date. You don't know if it's a Monday or a Tuesday.
Because you're still
every day is
work.
the same. Every day is the same.
It is Kwame Nkrumah's birthday,
You
or
have no
it's
clue.
March, or it's 25th December, 26th December. So far, my most horrible shift was on 26th December. It was deadly. It was bloody. I didn't even want to remember that. Really terrible.
I think I came for 9th on the 18th.
Yeah, and I did day cover. And
It
we had some
wasn't good. It wasn't
back-to-back
good. I remember we used to do like
emergencies.
12 hours, 12 hours,
Every
12
single
hours.
day, 12 hours. I really lost weight. I'm still trying to recover. Yeah. Still, we learn.
Yeah, still a learning
So
process.
still doing like rounds. You are still asked questions sometimes as though you were a medical student.
Yeah.
You still answer questions, and sometimes we still sit down to discuss certain medical conditions. When I was a medical student, a few of my colleagues got to assist in certain, procedures in the theater. House job, you would get the opportunity to assist in certain procedures as well.
I think the most traumatizing part is the final exams.
Yeah, medical
Then there's a lot of
school, yeah.
expectations. Your family is expecting that you finish and send them your photo shoots.
And you've taken your
You have
pictures
a whole
already
lot
because
of-
and you want to post
You
them.
have a whole lot. Yes, so
You want
that
to
that
post
whole thing is an emotional stress.
Yeah, final exam,
Yes.
medical.
But aside that, when you're done, there are months. I don't know why we're rushing to start house.
oh,
why?
should have rested.
We started house job too early. Oh.
Mm,
We're enjoying the house, but I don't know, for some reason we are here.
yeah,
But I mean, the good thing is that you get to finish
get to
your
finish early and
rotation
rest.
quickly.
ahead of
But there's
your
no
second
rest
year.
though.
Well, ahead of your second year, you can take like a month break or.
But a month break in Ghana.
If you have the money, you can chill. Okay.
Can go out, yes. And lifestyle. Let's talk about lifestyle. Sense of lifestyle comparison.
I would say when I was in medical school, I felt, should I say, more free. Like,
Yeah.
I think I was open to the idea of going out a lot more, especially with my girls.
Your vlog.
yeah, we used to hang out a lot. Now, although I have that freedom to go out, like maybe after work, I'm just tired. Like I just want to, stay in and then, try
that's
and recover
true.
my lost energies.
This
Yeah.
is true. Because I think medical season, I could go to church frequently.
Yeah, that's
could
a
do some
very important
activity.
point. Oh my god.
I could just be there was just a lot of time because in UDS there's time, but you just have to know how to use your time wisely.
Exactly.
Yes, there are some weeks you're not really doing much, but you're just learning in your comfort and all that. That's cool.
Yeah.
But and you can do whatever you want to do. You can wear whatever outfit you want to wear, go wherever you want to go.
As long as it's official.
Talk to anyone, anyhow. But being a medical doctor, I said you've sworn an oath. You can't talk anyhow. You can't say your mind.
You can't fight in
You
public.
can't fight anyone. You can't even
You
fight.
do things anyhow.
You can't do
again.
things anyhow. You can't dress anyhow.
You can't wear it go back.
Yes,
I think at the induction ceremony, that's what they told us. You can't wear it to someone.
So I have a problem with relatives that will be mentioning dog at places that they don't know you.
Oh, Charlie.
You want to buy something very
Charlie.
simple and new. There's someone is calling a dog and you're just standing there. They don't know
Now they'll
are you
increase
buying
the
for the
price.
person or not?
Yeah, but to be very honest, to stress on the church aspect, when I was a medical student, every Sunday I was in church. Okay, and I do spoken word as well, so I was doing it back to back every Sunday. I was going for our midweek services. I was a
very
regular
active.
church until right now. My pastor loves me, so but then sometimes, for 2-3 weeks, you won't be able to go to church and you're feeling bad, you're feeling guilty.
You're
So
just
you need
stuck.
to make time to pray on your own, to read your Bible on your own, try and fix those things in between.
But like in medical school, like which rotations did you like the rotations you went through in medical school and now that you are in house job
Which
comparison?
So my school.
So we can, I think we can
obviously
just talk
went
for
through
surgery and peace, because that's what
NPs,
you've
yeah.
experienced. There's the pressure increase or decreases.
Like, oh, because I think it was up until some few weeks before our exam that I finally got to know what was happening. Like,
Yeah.
I sat down in group studies and I got to understand that everything is done by weight. You know, the fluids are different and everything was different. And I now got to understand. But for some strange reason, I didn't know what was happening at the beginning.
And then you just switched to ONG.
Yeah, but ONG, funny enough, I knew what was happening.
That was fine.
Yeah, and I enjoyed it. Yeah, I think I enjoyed it because my boss was Dr. Hawa. Yeah, she's busy, but she had time for us, and then she still taught us well. So I think in comparison, Ops and Ghana, I enjoyed Ops as compared to Pete, and surgery as well. Oh, Prof taught us so well.
Yeah, I used to join his group. I was not from his group though.
So I greatly enjoyed surgery. Like, I really understood certain things and all of that. And I think house job so far, beats in comparison to surgery, I'll not talk for now. I think I'll prefer I finish the year.
Or the whole
no,
year.
All two, yeah. And then
All two.
compare
Okay.
Pete
That's
and surgery
fine.
well and see, fingers crossed.
You know, sometimes when you are doing tutorials, you get to hear other people's opinion, and you it's like more like a confined zone and a discussion. So you get to ask all your silly questions.
Like a safe space.
Yes, you get to ask all your silly questions and get them addressed within your space. By presentations, you're certain that you're hungry. So you don't even know. There are like 4 or 5 people presenting, and you know when someone is presenting, you kind of focus. The next person that comes has to follow the same rhythm. If the patient is not if that person is not following the same rhythm,
You have to now
thought block.
Yeah.
I just can't follow again. So it was just all over the place.
Okay.
So the little tutorials we used to have in my group, that was what was helping me in the presentation there, right? That was it. And I was sitting in front. I was always in front. I'm like, so when you're presenting, I'm just waiting for you to finish and go, because I was still going to read it on my own anyway. So whatever you're saying, I'll go and read it. So it's just a little thing the bosses add after the presentation that I find very cool. So that whole rotation there was, you know, Pete too also was the same thing, presentations, but that one, the tutorials was classic. Do you get me? Like, you know that these days, this day is tutorials. Yes,
and you
all
better
that.
read before the session.
Surgery, I like surgery more in PBO4 because there were a lot of excuses. Oh, you just got a clinical year. It makes sense that you didn't know. Do you get it? It makes sense. Oh, you don't know this, or now you know this. Do you get it?
But
by final year, where's the excuse?
You don't have any excuse to make. You really can't.
You can't say you don't know.
Hey.
And that's translated to hard job, because now you should have known. You get it? Do you get enough time to read?
Well, I planned to. On some days I will. Some days to the tiredness I'll just.
I think
sleep.
sometimes the reading reads me, because we'll be trying, but it's not going.
Some days you will come and sleep. But let's say if I encounter a new case that I know that I'm not going to present for the first time the following day, that one I would force myself and sit somewhere and read, because you can't afford to embarrass yourself doing around.
The fact that you feel like you might embarrass yourself is enough
It's
adrenaline
enough to push you to
read. Yes.
It's enough to push you.
But has there been an instance where, like, a diagnosis wasn't too clear to you? You finished clerking, you've done all your
Oh yeah, quite a number of times.
Socrates of whatever, and then you still don't know what impression to give.
Quite a number of times. You know, some of the patients will just say yes to all your questions. Like, please, have you been vomiting? Yes. Okay, have you been having this? Yes. Are you having diarrhea? Yes. I haven't constipation? Yes. So which one are you having?
So now you can't even take important negatives, because they're all positives.
So me, whenever I get in such a situation, I always call my bosses, like, right now. Call them and tell them, boss, this, that. I'm confused. Yeah. Because why force myself when I'm still learning from them?
Yeah.
Do you understand? Yeah.
But what about, have you encountered patients? I think I've encountered 2 or 3 where the patient said, oh, I don't cough, I don't have headache. Then doing rounds, like today's admission day 16. Currently, there are no complaints. Patients like, oh, I'm coughing.
Then you look like a liar. It's true. Oh, I think it's happened. One of our patients. So during our reviews, okay, we asked him to lift his legs. This boy lifted the legs nicely. During rounds, we were saying, oh, lift the legs for bossy that you are getting warm. He was now.
You can't lift the leg again.
And we're like, boss, he lifted the leg this morning. Oh, we had to explain this later, you know.
No evidence.
Yeah.
So
But then
they
because we
actually-
have cool bosses, they were like, oh, don't worry, we understand.
Yeah.
It's happened, blah blah blah, and then that was it. However, there's been instances where we had to contribute money,
Yeah.
to buy certain drugs for some patients, to also pay for their lab investigations.
Yeah.
One more difference between house job and medical school is that right now, like when you start house job, you get something small, some allowances to keep you going. At least you start earning, monthly salary here and there. Yeah, to just keep you going. But in medical school, unless of course you are from a very affluent family, you'll be managing some. Yeah, but I think that's one positive thing.
But medical school, you can go, oh, and they say we should buy this. Say how much you mention the amount, they'll send it to you. That's medical school. Now after you've had your pay, you're all looking at each other's faces because no one's gonna buy anything else for you. I think I was probably richer in medical school than when I started house job in the beginning.
Oh yeah, definitely.
So thank you guys for watching this video. If you liked it, give us a thumbs up, subscribe, comment. We want to see a lot of comments. We want to see a whole lot of comments.
Yeah.
Subscribe, and then we're back with another video. Bye.